Thank you and good afternoon. This is Sam Vaughn for Sam's Sports Report and Sam's Mental Health Day. The Kansas Jayhawks get another loss as they lose to Duke. They are not off to their normal start as they are still rated 23rd currently. They have an upcoming game against Notre Dame. It'll be 2:30. Speaking of Notre Dame basketball, they just a little cover for them. I know most of your Notre Dame fans don't care about basketball normally. I figure I'd give an update there. They are 3-1 on the season. Their one loss coming to Ohio State, and a close one just recently, 64-63. Notre Dame plays tonight, comes up and shooting the ball dominant on the glass by Mark Britton, sharpshooter Braden Sherby, the big man, and Carson Townt gives them Irish a major edge. Brillam can score with senior forward Jack Kriznick, who is averaging 20 a game, and they use pressure defense but struggling defensively and getting out-rebounded this season. Bottom line, Notre Dame size and depth should make them a clear favorite at home. Game time for that game is at 6 o'clock ACC Extra, whatever the hell that means. It's hard to tell maybe, but Mizzou is clearly off to a good start. At 5-0, they did struggle against Southeast Missouri, winning only by 5. Struggled in the first half over Minnesota, but Mizzou ended up winning by 23. Rest of the games have been rather easy. We'll talk about Mizzou's game tomorrow as they tip off at 7 against South Dakota State at Mizzou Arena, 7 o'clock again. Two great games tonight, Arizona versus UConn. Short previews. Number 4, Arizona will play number 3. UConn wins Wednesday at 7 p.m. Eastern. Line is UConn favored by about 6 or 7. Arizona is 4-0. Freshmen start like Keo Poto are big-time talents, but consistency is the question. UConn is also physically and strong defensively, especially at home. Arizona must avoid early turnovers, rebounds, plus the defensively slowing down the physical game. Pick lean on UConn at home slightly. Lean to the under. Tip is at 6 at FS1. A SEC foe against a Big Ten opponent. Illinois is at Alabama. Alabama is 11. Illinois is 8. Illinois versus Alabama at the United Center. Actually, in Chicago. Illinois is favored by 3 or 4 points. Illinois comes off a high-powered offense. Alabama is talented but coming off a recent loss and has struggled with turnovers. Alabama lost to Purdue, won over Alabama 87-80 last Thursday. Keep Illinois scoring and pace for Alabama ability to defend and control the tempo. Tip is tonight at 8 o'clock on FS1. I said we were going to talk about college football, and we will. Mizzou blew out Mississippi State, and Ahmad Hardy showed his speed and why he is one of the best backs in the nation and now leads the nation in rushing. He has 15 touchdowns and outstanding yards per carry of 6.8. Mizzou has a tough one this weekend against OU, or Saturday. But OU is favored. The Oklahoma Sooners are favored by 7.5, and Oklahoma is 8, while Missouri is number 22. Kick is at 11 at Oklahoma. SEC Network. Kansas had the bye last week and is bidding for bowl as they need 6 wins. Iowa State is 6-4. They host 5-5 Kansas. This game airs at 11 on Fox Sports 1. Kansas State is going to have a tough one against Utah as they're looking for a bowl bid. If they don't get it done this week, they would hopefully get a win against Colorado, who they host next week. This Saturday, kickoff against Kansas State and Utah is at 3 o'clock ESPN. Number 7 Oregon will host USC. That's the other ranked game. Oregon is number 7. USC is number 15. That game airs at 2:30 on CBS. A rather quick video on GAD, generalized anxiety disorder.
Generalized anxiety disorder, GAD, is a very common mental disorder characterized by excessive, difficult to control, and often irrational worry about everyday activities. The worry is persistent and typically encompasses different areas of life, including work, health, finance, family, and relationships. Patients have hard time with daily tasks and often present with psychological as well as physical symptoms such as restlessness, muscle tension, digestive problems, headaches, and sleep disturbance. The mechanism of GAD is not well understood. Some evidence suggests that GAD patients may experience persistent activation in areas of the brain that process stimuli associated with fear, anxiety, and emotions. Dysfunction of brain pathways involved in anxiety, such as serotonin and noradrenergic systems, is thought to be responsible. Development of GAD is likely due to a combination of genetic and environmental factors such as significant life changes or traumatic events. Women are somewhat more affected than men. Other risk factors include lower level of education, chronic illnesses, and other mental disorders. Diagnosis of GAD is challenging. Patients must be tested to rule out other medical conditions, psychiatric disorders, or use of substances that may produce similar symptoms. Diagnostic criteria published by the American Psychiatric Association include excessive anxiety occurring for more than half of the time and ongoing for at least 6 months. The anxiety is difficult to control and is associated with at least 3 of the following symptoms: restlessness, fatigue, difficulty concentrating, irritability, muscle tension, and sleep disturbance. The anxiety results in significant distress or impairment in social and occupational areas. Symptoms are not due to other conditions or substance abuse. The GAD-7, a questionnaire of 7 items, is usually used as a screening tool and for severity assessment. Greater GAD-7 scores indicate greater severity. Treatments are most effective when combining lifestyle changes, psychotherapy, and medications. Lifestyle recommendations include identifying and removing possible triggers, eating healthy, practicing relaxation techniques, improving sleep, and doing physical exercise. Medications include antidepressants, anti-anxiety agents, and benzodiazepines. Selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors are considered first-line therapy. All antidepressants should be tested for optimal dosage and taken for at least 4 weeks to determine efficacy. Patients must be monitored for adverse effects. On the other hand, benzodiazepines are generally prescribed only for relieving acute anxiety on a short-term basis because of potential risk for misuse and dependence.
Some of these strategies that we'll go over will be apps: Calm meditation, naps, sleep, story time, daily meditation. A new one, Peloton app, can be used on your phone for thousands of workouts. As we know, exercise can be a key part of your mental health. Bench is a good app to use to set daily goals. It's helpful to use every day so you know what task you can get done. They set you help goals on that app. There is more mental health apps. Here is Google that comes up with 42 different apps. A link. It helps your mental health. Click on this link to learn more. This is Sam Vaughn for Sam's Sports Report and Sam's Mental Health Day.